So one of my highlights from this meeting is an abstract by Dr. Sangeeta going over how menarchal status affects spinal height in children diagnosed with lupus. It's a large cohort of female patients, over 500 female patients, and they compared what their final height is as an adult by menarchal status. So comparing premenarchal to postmenarchal and when they were diagnosed with lupus, whether that was premenarchal or postmenarchal. And what they found is that the postmenarchal, so if they were diagnosed after menarche had started, they were significantly taller than those who were diagnosed premenarche. And the reason I think that's important is because, one, because does the disease itself cause that, just from the inflammation? Or is it the medicines we use? For lupus, we use steroids to help control the disease activity. And one of the side effects of that is that it may impede growth. And so just to be aware of that as clinicians, that to minimize steroid use if possible. So the next abstract I found very enlightening was by Dr. Tamara Rubenstein about screening youth who have lupus for depression. And it was a multi-center study that administered survey questionnaires asking about depression, anxiety, and children's mood in a clinic with lupus. And what they found is that only 17% or so of children had even been asked these questions previously. But over a quarter of the children had depression, clinical depression by these questionnaires. And I think that for me, as a practicing pediatric rheumatologist, that's important because I now want to start incorporating these questions about mental health into my practice. Depression can play such an important role in pediatrics, whether that's just in how they interact with their peers and their families, but also in their compliance with therapy. So if they're more depressed, they may not want to take their medicine. So I think it's important to start addressing that in clinic.